friends, I'm Dr. JASWANT Patil. I've done my MD chest in allopathy from ZGS Medical College, KM Hospital, Parel, Mumbai, and BHMS Homeopathy from Maharashtra Health University, Chamunda Mata College from Jalgaon. And I have studied 117 alternative science to know more about the science, to explore by which way I can help my patients to come to the health from the severe diseases they are suffering from. Allopathy has got its own limitations. Both allopathy and homeopathy has got their own pros and cons. I take the good part of allopathy, the diagnostics part, the prognostic part, and the understanding the basic human anatomy and the physiology of the diseases, pathology of the diseases. That has helped me in prescribing into homeopathic medical science. Now I practice mostly homeopathy, where 10% cases where we cannot do without allopathy, there I have practiced allopathy. For in conjunction with homeopathy, there is a big confusion that both can go together or not. But if it are properly combined in the cases where there is no choice left and they are irreversible cases, there the combination of both works very well. But where there is a reversible case, I would prefer only homeopathy, because it cures from the root and gives you the concrete results to stay healthy, with energy, with happiness and good mood all throughout your life if it is been properly prescribed. To come to a conclusion that why I came from allopathy to homeopathy, based on this theory, my mother was suffering very badly from chronic diseases, diabetes, hypertension, diabetic complications, and lung disease, cardiovascular disease, so with renal failure. And we were trying very hard. I had my own nursing home of 20 beds at Jalgaon, and with that I found that one day she was serious. I admitted her to my ICU, and there it was seen that she is not recovering. She is going into multi-organ failure and she was not responding. We have given all types of allopathic treatment. I had an experience of working in IRCU, ICCU, IMCU, ITCU and ICU. So with all that vast experience, I was feeling helpless that I cannot save my mother, and I was seeing that I am losing her, and shortly in a span of few hours I may lose her. That time I got panicky and I prayed God that give me some way, I find out some way for my mother. And luckily I came across a homeopathic book gifted by my homeopathic friend, and he said homeopathy is good, but it never applied to my allopathic mind that the homeopathy can be given in this way. So that was a situation where I was trapped. I opened up a book, and luckily the medicine that came in front of me was exactly fitting my mother's clinical condition, and one dose of that RSI 200 has done a magic in her life. 24 hours she was settled down, 48 hours all the gadgets were out, and 72 hours she was out from ICU, moving around, taking food like a normal person. It was unbelievable that I have seen so many patients suffering in ICU when I had worked, and this was a magical results. That inspired me to turn towards homeopathy. Then I learned all the books, and then I took a regular admission to a college. I got my BHMS degree, and I am practicing on chronic diseases. But even in some cases where there are limitations even to a homeopathy, I found out that I must study, explore more and more sciences, like I got experience in homeopathy. So I explored almost all alternative sciences, and I found even the acupuncture works very well, because it gives a prompt relief on the spot on the bed from the pain, and combination of all these things together in intractable cases, not in the simple cases. I practice classical homeopathy, where you give single remedy, single dose, and you see the results. Repetitions are required, that time they are done, along with complementary and follows well medicines. So this all experience together has given me a new insight of combining all the sciences where they are required. Where they are not required, homeopathy is the best. Thank you.